Next drug up on the list is going to be barbiturates. Now, not much to say about the barbiturates, simply because they're not used as much nowadays. They are used typically in anesthesia. However, their use has been replaced by benzodiazepines because of a safer profile. But, just as a frame of reference, Jimi Hendrix overdosed on a barbiturate and thus died. So it is possible to die on barbiturates. It is common, however, nowadays less common. So a barbiturate is a CNS depressant, kind of like alcohol is, kind of like a benzodiazepine is, just let's classify them on a little higher scale. They're going to cause everything that a benzo does for the most part. So a benzodiazepine overdose or an intoxication, plus they're going to have increased respiratory depression. Wow, can't read that right. Respiratory depression. All right. So they're going to have a harder time breathing, pretty much. So that's about all I'm going to say about that. That's about as high yield. The one thing you want to monitor for is the adequacy of ventilation. Are they getting enough oxygen is the big question. Now, withdrawal symptoms, typically you'll see them within a couple hours. They're going to include anxiety, seizures, pretty much stuff that we saw with benzodiazepine overdose, similar to alcohol withdrawal as well. Sorry, benzodiazepine withdrawal, alcohol withdrawal. So we're going to get that picture of autonomic instability. And then lastly, let's talk about the treatment. Really, it's just going to be supportive. You may require mechanical ventilation. If they're going to ask you a question regarding the treatment of an acute dose of barbiturate intoxication, I do think that they'll tell you that the patient goes into respiratory failure, or it's going to say, what do you need to most watch out for? And that's going to be respiratory failure, because you need to determine, do they need to be intubated and ventilated mechanically. Also, you can try giving activated charcoal, you can try naloxone, but really the number one thing that you should take away from this is going to be, is mechanical ventilation needed?